Welcome to our community forum. My name is Corina Herrera Loera, Public Information Officer for the Santa Clara County at the Emergency Operations Center. I am happy to have all of you tuning in today. We have a lot of great information coming to you. This is the second community forum that we have. We held one last month with our South County community, and today we're holding one focused around our East Side community. We want to focus with our communities who have been the hardest impacted by COVID-19. And so we're just trying new ways to connect with our community. So this is one of them. Thank you all for joining us. As I mentioned, we are here. I am joined by two amazing public information officers as well. You will be hearing from Maribel Martinez in a little bit. And we also have Quetzal Gomez, who's also helping us monitor the background, making this magic happen for you all. I also want to begin today by acknowledging the hard times that we've gone through. 2020 was definitely a difficult one. 2021, although we feel like, we're at the light at the end of the tunnel, we're still not there, but we're close. So I just want to acknowledge, the hurt, the pain, all the stressors, our children having to connect through social distancing in school, the parents who have been right there with them, some of us who are holding 2-3 roles, at the same time. Just want to acknowledge all of that at this time. I know it's not easy, but we will get through this all. And also, I just want to acknowledge the fact by you showing up today, can save a life, right? Like that information that we can get out to our community sometimes is life-saving. So if you get the information that maybe somebody else might not know, you could pass it forward. And then invite others to our next community forum. So looking forward to sharing the information that we have to make sure that our community is well informed and have all their questions answered. And so also want to acknowledge that we've received great questions already. Thank you to all of those who have sent us questions by text and email. We did our best to incorporate those in our presentation. We'll also have some time for Q&A, and know that if we don't get to all of them, because we had several great questions, we will host another community forum on February 21st, where we will just be focusing on vaccines. So just want to let you all know that as well, but we will do our best to get to all those today. So without further ado, I want to go ahead and hand the mic over to Maribel Martinez, who's going to be guiding us through a presentation of COVID. Thank you, Maribel. And so I'll let you take it away now.
Hi, good evening, everyone. So I have a short presentation for you that's going to go over some of the basics of COVID-19, the resources available to you through the county, and just talking a little bit about vaccines. Like Corina mentioned, we have another community forum that's going to be all about vaccines in just a couple of weeks on the 21st. And so we will hold the bulk of that conversation of the questions for the vaccine portion for that date. Today is just going to be a broad overview, just so that folks get kind of the general information about that. We'll also make sure that to share some resources about what we have locally, so that you can get all the information that you need to support your family members and any other community member that may need this information. So at any point, please feel free to snap a photo of the slide or your screen so you can keep that. And because this is being recorded live on our Facebook page and on our YouTube page, it's something that you'll be able to share and send the video link to folks around you in case you want to review the information or share it with anybody else. So what we know, right, is that COVID-19 is transmitted primarily person to person through these respiratory droplets and aerosols that come out of our nose and mouth when we talk, sneeze, cough. And so that's why it's super important that we continue to wear our face coverings that cover our nose and our mouth and are fit snugly around that, and that we keep a distance of 6 feet in between. A review of the symptoms of COVID-19. These are the most common symptoms, but we know that it's not an exhaustive list. But should you ever experience fever, chills, cough, shortness of breath, or difficulty breathing, sore throat that's new or unexplained, fatigue that's new or unexplained, muscle and body aches that's new or unexplained, headaches, again, new or unexplained, loss of taste and smell, and nausea, diarrhea, or vomiting that's new or unexplained. These are symptoms that you might have COVID. Please go to the ER or urgent care if you ever have trouble breathing, have purple lips, or if you or someone around you loses consciousness. This is a clear indication that you need to seek medical attention at that point. An overview about quarantine and isolation. We get a lot of questions about this topic. Quarantine is the word that we use when somebody has been exposed to COVID, exposed to somebody who has a confirmed case of COVID, exposure to somebody who tested positive to COVID. And what you should do if you have come in contact with somebody who tested positive to COVID, is that you should remain home. You should quarantine for 10 days. That means you don't leave the house for any activity. You don't have visitors. You don't go to work. You don't go through the drive-through for any fast food restaurant. You stay home. And after those 10 days, you monitor your symptoms for 4 additional days. Typically, we recommend that you plan to get tested on the 6th day. That's the only reason why you would be leaving your home, is to seek medical care or to get tested during this time. And we definitely recommend that you do the drive-through testing at the fairgrounds. That's a great resource to you that you could use. If you have already tested positive, you have a confirmed case of COVID, you should go into isolation. This means that you isolate for 10 days and continue to monitor symptoms. Isolation means that you stay separate from non-positive people who are in your same home or in that same living environment, that you don't share a room, you don't share dishes, you don't share spaces, you don't share utensils, you disinfect all the common areas after each use, and try to not have shared use spaces. You don't go out for any activities, you don't have anyone come visit you, and you do not go to work. As you can see in the photo, people leave food or medication at the door, not have any contact with each other with somebody who is positive with COVID. As a reminder, COVID-19 testing is free, safe, and easy and confidential. It doesn't impact your immigration status. You don't require a doctor's note, and you don't require to have health insurance or health care. These are free. There are lots of different locations all over East San Jose and throughout Santa Clara County. You can go to any of them. There are some that you have to make an appointment, and some that you can just walk up and wait in line for your turn. We will never ask you for money out of your pocket for this test, and you can get tested as much as you need to. So you should be getting tested if you have any exposure, or you think you have been at risk of exposure. And if you are a frontline worker, you should be getting tested with frequency recommended once a month or as much as twice a month. that is what you should be doing with a routine. Here's some information. Sorry, I think this one was not translated from our Spanish one. So let me just highlight those numbers for you. If you are looking for resources, it's 808-7770. That's if you have already tested positive for COVID and you are looking for resources for food or lodging, temporary lodging for you to recuperate. If you'd like to schedule a COVID test, or schedule your COVID vaccine, you can call 211. If you have questions about workplace, you can call 1-866-870-7725. And if you'd like to report any complaints about a business not following with the safety protocols, or any other suspicious or fraudulent activities related to COVID-19, you'd call the DA's number listed here at the bottom of the page. A little bit about vaccines now. There are 2 authorized vaccines. One is the Pfizer brand and the other is the Moderna brand. They are both approved and authorized by the state of California and the U.S. Food and Drug Administration. They both are effective with 2 doses. They are effective in preventing COVID-19 illness, meaning you are not going to experience COVID symptoms. And the most common side effect for both of these is that you will have either pain or swelling and redness at the point of injection, which is your arm where you get the vaccine. And you might experience throughout your body some chills, tiredness, and aches. They, again, require a second dose. And the difference between these two is that the Pfizer brand, you have your second dose after 21 days. And for the Moderna brand, you get your second dose after 28 days, excuse me. So 21 days for Pfizer, 28 days for Moderna. Right now in Santa Clara County, the folks who are eligible for a vaccine are anyone in phase 1A. 1A are any healthcare employees, including those who work in clinics, in laboratories, paramedics, EMTs, folks who work at skilled nursing facilities, psychiatric acute care, and anyone who does healthcare and in-home supportive services, community health workers, including promotoras, all public health field staff, and primary care clinic workers. We are also having people who are 65 years of age or older get vaccinated as well. And they can go through their healthcare provider or through any provider vaccination center in Santa Clara County, again, by calling 211 or going to www.sccfreevax, that's vax.org. You can register online through that portal. And again, you can use any of the county's vaccination centers with no barriers. You could use any that are available and are taking appointments. Again, if you ever need information about COVID-19 or where to find resources, you can call 211, or you can send a text message of COVID-19 to 211-211. And I think that concludes that piece of the presentation, and we will go directly to any of the questions that we have already from our chats or any other comments that we have online.
Thank you so much, Maribel, for that information. And just before we move on to the questions, I just want to remind, I know there's plenty also of schools, cafecitos, meetings, that you can take this presentation and show it, to your parents or any other group that you might have. So let's go ahead and go to our questions. Quetzal, feel free to let us know if I'm missing any. Otherwise, in the meantime, I'll go to some of the ones that we received through text and email prior to today's event. So one of the questions was, good day, my mother is turning 65 on May, but denied for vaccination. Is there a way we can extend the service to anyone turning 65 already? Thank you.
Great question. You do have to be 65 the day of your vaccination. So although this person's parent is not able to get their vaccine today, once you're 7 days away from that date of when this person turns 65, you can schedule your vaccine and get your vaccine when you are 65.
Thank you. The next question is, when do you expect the next part of Phase B to proceed?
Yeah, that's a great question, and it has a little bit to do with the number of vaccines that we have available, and that allotment of vaccines comes from the federal government to the state, and then the state to the county, and also looking at the number of the percentage and the numbers of people in the current phase that have been vaccinated. Once we have vaccinated folks in the 1A and in the 65 and older, then we can begin expanding with directive from the state. So we don't exactly have a clear timeline for that, but as soon as it's possible to do so, our county will work diligently to make sure that everyone in our county gets access to the vaccine.
Thank you. The next question is, when will the county expand the 150-mile travel restriction and mandatory quarantine or align with the state travel restrictions?
Yes, our directives are for folks who travel outside 150 miles to quarantine upon return. But then we do have a reinforcing directive from the state that's 120 miles, and we do this, and our health officers and all of the team that's working to make sure that our county stays safe, have reviewed this and feel like this is a strategy to ensure that folks who travel, stay safe in the community around them. And we actually saw that in effect this week, where we had individuals who traveled and tested positive for coronavirus and tested positive for one of the new strains. And because they quarantined, we have really isolated the spread of this new strain in our county through those individuals. So we know that policy works, and that we're doing the best we can to make sure that we have a safe community for all around us.
Thank you. That's a great example as to why we have these directives in place, right? And saving lives. The next question that I have here is, currently restaurants are not allowed to have customers wait inside to take orders per the November 30th, 2020 directive. Since there is a capacity limit and social distancing protocol, why is this still in effect, and when will this be lifted?
Yes, we are in a purple tier, and this means that no indoor gatherings or indoor services for food are authorized during this time. And we do so because we don't want to have people be in situations or circumstances that put them at higher risk. And we know that anytime that you're indoors and there is a chance that somebody will remove their face covering, say to eat or to drink something, you're at higher risk of spreading COVID-19. And so due to the tier that we're in and due to the safety precautions, there is no indoor services being offered at them. Once we see the numbers go down, once we see that happening in our community, then we can begin to ease up on any of the restrictions like we have in the past. And we definitely thank the community for everything that you all are doing to ensure that our businesses can reopen safely, and that we can provide opportunities to our community, of course, in a safe way.
Thank you. Is there discussion on expanding the Santa Clara travel restrictions miles or to match the state?
Yeah, we always in our planning always note that that we are in alignment with the state, and whenever there is one policy that is stricter than the other, we follow the stricter one. Again, to have an abundance of caution so that we can ensure that our community stays safe.
Thank you. Does the 20% capacity limits include the employees working? Do you count customers who are actively walking through the restaurant for pickup and takeout?
Yeah, that's a great question. And there's actually on our website, www.sccgov.org/coronavirus, or if you go COVID-19, there is an entire portal for businesses. There is a capacity formula. You can put in the number of your square footage that's available for public access, the number of employees, and it'll give you that exact number. It takes the guesswork out, so that you can ensure that you are in compliance with the directive.
Thank you. Businesses that are categorized as a restaurant, but that aren't necessarily a restaurant, for example, coffee shops, cafes, have been drastically affected by this operationally and financially. They are operating at the door with cold weather, rain, and wind. It is not a positive working environment for employees or service environment for customers. Retail businesses can allow people inside for unlimited time, while cafes cannot allow people inside 5 minutes to wait for a coffee beverage with a 20% capacity limit and social distancing. When will this be reviewed and adjusted? So I think, again, similar questions to earlier.
Yeah, and we definitely recognize that it's not an easy task right now, especially for small businesses, and we appreciate everything that they're doing. It's a great sacrifice to adapt the way that they run their business, to adapt, a lot of different processes for restaurants and cafes and other business owners locally. And I just want to underscore that, we're here to work together. We're here to support you. There is a business call center that's available. Again, through our website. You can also find information for businesses. We want to be able to support you. There are different city initiatives as well through the city of San Jose that are providing assistance, grants to small businesses so they can stay afloat. And so just know that we want to work with you. And this is a great point to share, and we'll make sure that folks who need to hear that, or maybe need to look into this further, do so that it is helpful to our community, ensuring that we stay safe and that we provide the services that we need in our community.
Thank you. Now, there's a couple of questions regarding the Levis Stadium, so I'm going to kind of ask them together. So the first one is, I noticed the county set up a new large site at the Levis Stadium where the Santa Clara County residents can get their COVID vaccines. Good job. Although currently it seems like only residents who are 65 and older and healthcare workers can get the vaccine. I'm glad that 65 and older people can get vaccines, but I am wondering when essential workers like grocery store workers will be able to get the vaccine too. Also, I am wondering where the contact tracers are, because I think people who try purposely spread the virus should be contact traced and monitored. I feel like our county doesn't really do contact tracing, and I feel like there should be consequences for people who try to spread the virus on purpose. If you could address these questions of mine at the webinar, I would appreciate it. And then the other one about Levi Stadium is, my husband is 60 with type 2 diabetes. He works at a public school. When will he be able to get a vaccine at the Levi Stadium?
Great. So both of these have to do with essential workers and folks who are most who have some heightened risk because they are working in industries such as education or construction or emergency services. Those are all folks who are part of the next tier, the phase 1B. So they are the next group to get vaccinated. Again, we don't know exactly when we will be able to move on to 1B and have these folks vaccinated, but they are the next in line. And we are doing everything possible, including the opening of Levis Stadium, to get as many of the folks who are currently eligible in 1A and 65 and older. The faster we get folks vaccinated in this category, and the more we get vaccines into our county, the faster we'll be able to move on to the next group, which is 1B, including these essential workers and educators. The other point about contact tracers, we have a robust team that's doing contact tracing and case investigation. They offer, support to folks who are confirmed cases of COVID and are tracking down how it spread and where we can interrupt the spread of COVID-19. They provide this in multiple languages and are working in our community. So if anyone receives a call from a number that says CA COVID team and has an area code of 916, they're actually calling from Santa Clara County's, they might be calling from Santa Clara County's contact tracing team, but they're using the state system because the state tracks all of these interactions and is all compiled in the state database to ensure that we are doing exactly what this question is asking for, that we track down how COVID is being spread and that we stop people as much as possible from spreading the virus.
Thank you. Is it possible to still test positive for COVID? And is it then safe to be around others who have also been vaccinated?
So this one's a little bit complex in terms of, can you still test positive after you've been vaccinated? What we're learning is yes. The vaccine takes a couple of days for it to actually activate the antibodies in your system. And we have had individuals in the media share that they had received their vaccine and then tested positive. What we're also noticing is that even if they tested positive, they're not getting any of their symptoms because their body has created these defenses due to the vaccine. We have to, even with the vaccine, we have to continue to follow all of our safety measures. And that means that even if you are vaccinated, you still wear a face covering that covers your nose and mouth anytime you're around folks who you don't live with or are in public spaces like a grocery store, and that you maintain distance. That is the way that we're going to continue to stay safe and ensure that folks around us are safe as well.
Thank you, Maribel. And I'm going to some of the comments that we have on Facebook. I do see Dr. Michael Boywonder Ibarra mentioning that it sounds like the previous question wasn't answered. And then he goes and says, if grocery stores are essential workers, shouldn't they have been one of the first in getting the vaccine?
Yes, so they are actually in the first tier. We're still in tier 1. Tier 1A are the healthcare workers, and because of their level of exposure, they're the first ones getting vaccinated. The essential workers, like grocery store workers, are still in 1, they're 1B. And so they're just, that next tier in this high priority group. So yes, they are prioritized, but they fall into 1B, right below the healthcare workers, that because of their constant exposure and treating people with COVID, they are at the highest tier.
Thank you. And I have a couple messages here saying hello from Angelica Perez, and we have one from Myra Zamora Nava. Just want to say hello to you all. Thank you for joining us. And I'm going to go into the other questions. If you tested positive for COVID-19, medical providers are stating the virus stays in your system for up to 90 days, but no longer contagious. Per the directive dated 12/10/2020, it is not recommended or required for retesting in order to return to regular activities if quarantine period is up and no symptoms within a 24-hour period. Are we by law required to retest and provide results to our employers or schools of a negative result? Or can we decline to retest as may come out positive again within the 90 days of period since quarantine is up?
Yeah, that's a great question. And again, we have our advice line for employees, that's part of the Office of Labor Standards and Enforcement. If you have any workplace related question, please use the number that's on the screen right now. They will be able to answer specific to your situation. Sometimes there's different variables that are at play, and so it's important for you to speak to one of these advice attorneys that provide free advice in multiple languages to make sure that you have the most accurate information to your workplace setting.
Thank you. And Maribel, I just want to, I know I mentioned in the beginning that we were focusing on the east side. So I'm going to kind of, remind folks, as we've heard in the news and, different reports, our numbers are high as Latinos in the community. We are the ones that are getting the most impacted by COVID for several reasons. And some of those, are the inequities that happen. Those of us have to live, with different families in one home, et cetera, all the things that our families have to go through that maybe others don't. And so, I'm going to read this question, and maybe in answering, if you can provide certain resources within our community where maybe some of our elders can access easily, because I know that's also important, right? That we bring the resources out to the community to ensure that our families are able to access them. And so let me read this. It says, the elderly population has many barriers that make it difficult for them to gain access to the COVID vaccine. People are having difficulty navigating all the information coming out about vaccines and are having a hard time keeping up with what is going on within our county. Many do not know where to go to get an appointment for their shots. Many have a hard time with technology, so scheduling online appointments can be very difficult without any help. Since there is such a high demand for the vaccine, appointments are being quickly snatched up, leaving very few options for our elderly population. Location and transportation is another major barrier. Given all of this, what can we do as a community to help assist the elderly gain better access to the vaccine, especially for those who may not have people in their lives that would be able to assist them?
Yeah, that's a great point. And in our vaccination plan for the county, we are definitely looking at ways to expand these resources. Last week, we had a press statement where we announced no wrong door, meaning that anyone, regardless of their healthcare provider, can get tested at any vaccination site. You don't necessarily, if you're a Kaiser patient, you don't have to wait for Kaiser for an appointment. You can come to our county site. If you're if you are a VMC patient and the Kaiser location is more convenient for you because of where you live or where you work, you can make an appointment there. If you don't have insurance, you can get vaccinated at any of the vaccination sites throughout Santa Clara County. What we're also doing is providing more spaces in our community where we can get vaccinated. I know in East San Jose, there's a vaccination site at the Mexican Heritage Plaza on Tuesdays and Thursdays. And those are walk-up appointments. You don't have to do an appointment in advance. You can just go there, wait in line and wait your turn and get vaccinated. We also have one-day vaccination events. We just had one last week at Happy Hollow Zoo that was put on by Aki. And so you'll see more of these in the community. We also have a vaccination mobile van that's going to different locations such as retirement homes and senior services locations because we know that that's a barrier for some folks in our community. We offer the opportunity for people to make appointments online, but they can also call 211 and make a vaccine appointment over the phone. because we know that that is also a challenge for some folks to navigate internet. So we are working on that. We're open to suggestions. So if folks who are watching this right now have a wonderful idea on how we can support folks, we will definitely are, we definitely are open to that. I know that there are other communities, like communities in Morgan Hill, that are have some volunteers that have drop-in sites where people get help coordinating and scheduling their vaccine, and some might even provide some transportation. So there are a lot of ways that community can support. And of course, if there's suggestions on what the county can do, we're open to hearing that.
Thank you, Maribel. And for now, these are all the questions that I have here. I'm gonna look and see if we have any from Facebook. We have Jessica Pala, who is asking, is there any information on when informal family caregivers to the elderly can get vaccinated? They just opened up that group for vaccination in San Diego and San Bernardino counties. So wanted to see if that's in the future for us.
Yeah, that's a great question. And our vaccination team is definitely keeping updated on what's happening in other counties in California. That's definitely, you raise a really great point about, having folks who take care of others, and how do we protect them. So thank you, Jessica, for all that you do to take care of your mother. And to all the other folks in the community who are doing the same. It's definitely something that we will bring back to our vaccination team and see if there is a plan on when we can begin to incorporate that. So thank you for your comment.
And then she just adds, if not, is there a way we can request that through the county or make our voice heard? It seems like an important group that should be vaccinated. If I get sick, nobody will be able to take care of my 88-year-old mother. So thank you for answering that. And yes, we will make sure to get that over to our vaccination team. Thank you, Jessica. And then now we have a question from Mayra Zamora Nava, who says, who's asking, where do the volunteers fit in that provide food services to the elderly, unhoused, and the most vulnerable, homeless encampments, transportation to getting to testing sites?
Yeah, that's a great question. And it's one that I don't have a very specific answer to right now, but we'll definitely work to get back a very specific answer for you. I don't know in terms of volunteers and what we would require in terms of documentation to show that you're a volunteer. So let me do a little bit more digging on that, and I want to be able to come back with you with the most accurate answer possible. But thank you for the question.
Thank you, Maribel. And we have another question here in regards to schools from Seema M. Any new directions for school opening?
Yeah, that's a great question. Right now, we're in the purple tier, which means that schools have to schools that meet the requirements in terms of cases per their 100,000 resident rate have the option of submitting a waiver to open schools. So those decisions will be made school district by school district. We know that some schools are opting for hybrid models that include distance learning and some in-person activities. So again, those would be district by district decisions, and they may differ. So I think for the question or for when that might happen, say in Alum Rock or Franklin McKinley or East Side, it'll be those individual districts making those decisions.
Thank you, Maribel. And then just as you know, I wear another hat, trustee president for the Alum Rock School District. So just in regards to the Alum Rock School Districts, just want to let folks know that tomorrow our superintendent will be giving a presentation on that at our board meeting. So you're welcome to tune in there to hear the specifics to the Alum Rock School District. As Maribel said, every district will be different depending on what's happening in their district, in their area. Also want to mention that we have one of our Emergency Operations Center member who works with Santa Clara County Office of Education. And in the future, we will be having focused community forums. And so what we're thinking is having one specifically for schools in the future, where we can have panelists answer any questions related to the schools. So Seema, I just want to mention those so you can look out for those community forums as well. But yeah, so for now, we would just suggest that maybe you check in with your specific school district to find out what they're doing. Thank you, Maribel, for letting me add to that.
Yeah, absolutely.
Let's see if we have any others here. I think we are good for questions for now. If anybody wants to add any other questions, we have a thank you from Jessica Pala. Thank you for joining us, Jessica. We appreciate you participating as well. Mayra Zamora, thank you again for joining us tonight and asking questions. And yes, we definitely appreciate Maribel and all the work she does. Thank you for getting back to her. We'll wait a couple more minutes. Otherwise,
yeah, and I would add, if there are certain topics like schools that you'd like to know more about, I know that we have our next session coming up on the 21st around vaccines, and so we're going to have one of our vaccine team experts be here and answer all the questions about vaccines on the 21st. But if there are other topics that you'd like to know more about, or that you'd like us to dedicate an entire forum on, please let us know in the chat. Or if you have other questions or topics that you think we need to cover, please feel free to add that. We are here to answer your questions and to serve you in the best way possible. So if you give us those topics, those themes that you'd like us to cover, we'll definitely be able to go back and find the information that you need if we don't have it on hand right now.
Thank you, Maribel. We do have a question that came in through YouTube. Thank you to those that are joining us by YouTube as well. Do the vaccines protect against the variants?
Yeah, so that's a very interesting question. A little bit of a complex response, because we have multiple variants that we're now seeing in our community, and so we're actually going to hold that question and have that be answered at our vaccine forum on the 21st, so that we can spend a little bit more time with some of the vaccine experts to dig deep into that answer.
Thank you, Maribel. So February 21st, make sure to put that on your calendars. Let's see, any other questions, comments, topics that you'd be interested to learn more about? And again, as you think of it later, you can come back and put it in the comments. We will be monitoring the comments to ensure that we're providing the resources, services, and information that you all want to hear and need. So I also want to give a shout out to all the ambassadors and embajadoras that have been training for the past couple of weeks to also support, in providing information to our community and accurate information, and also, being able to clarify any myths or any, questions that might still be out there. So if I don't see any more, unless Maribel, you'd like to add anything before we close, thank you so much for the information, and I'll leave it to you.
Yeah, no, just, this is an initiative from our Emergency Operations Center PIO branch, our Public Information branch. What we really wanted to do is provide a space for our community to ask questions. We know that sometimes it's hard to keep up. There's a lot of information, and sometimes hard to tell who the source is, whether we can trust it or not. And so we want to create these forums in our community that are going to happen monthly, where we hear directly from you. Whereas you see, we have a short presentation, but we really just want to answer the questions that you have. So keep the questions coming. Please share this resource with other people. And we really want to make sure that this gets out to everyone. We're doing it on Facebook Live. We're doing it on YouTube Live. And again, the recording will be available after the event so that you can share it. Please post it on your Facebook page. Please share the link with folks in your networks. We want to make sure that people have the most up-to-date and accurate information, and also have access to us to ask any question that they have about COVID, the directives, or any of the resources available here in Santa Clara County.
Thank you, Maribel. We do have a question that came in before we got off. It's from Mike Nguyen. And is Levis Stadium open for vaccinations?
It is. Levis Stadium is open for vaccinations. If you go to sccfreevax.org, that's the website where you can schedule your vaccine. There'll be a drop-down menu that allows you to pick which vaccination center you'd like to schedule your vaccine. If for whatever reason you get an error message when you click on or you have no dates available, it's because all of the slots have been already filled up. But Levi Stadium is up and running and is vaccinating folks that are eligible in the phase 1A and those who are 65 and older.
Quite great. Thank you. And just checking the comments, questions, see if there's any more, any missing. I think we have answered all of them up until now. And as we mentioned, we'll see you again on the 21st. We will be posting the flyers soon with the times. We are trying to have it, at least English and Spanish for now, making sure that we are getting the information out to the most hardest hit communities. So look out for those times for the 21st. And if I don't see any other questions, I don't. Thank you so much for joining us today. Thank you for doing your best, to get through these hard times. And I look forward to seeing you all at the next one. And thank you all for what you're doing. Adriana Espinosa, shout outs to you at the front lines, working in the hospitals, keeping our people safe and healthy and doing all the work out there. So it takes a village, and we are all needed, including each and every one of you who logged in today, to get the information out and to make sure that we're all safe and that we all get vaccinated when it's our turn. Make sure you make your appointments when it's your turn, and we look forward to going back and celebrating with you in community once we're all ready to do that. In the meantime, we'll stay at home, we'll get our vaccines, we'll continue to do what we can in order to provide the information necessary to you in the community and the resources as well, so that we can get all of that done. So with that, we'll see you on the 21st. Stay safe and healthy. Take care. Bye.